Time to Think Thursday. I'm Dr. Anthony Giacalone with Atlantic Coast Chiropractic. Today I want to talk about the hip flexor and how it correlates with low back pain. Very similarly to last week how we talked about the hamstring and how that correlates to back pain, the hip flexor is just as important and plays a vital role in stabilizing the back and the hip and also contributing to back pain. I have found over the last couple of years in my office, almost 75% of my patients that come in with low back pain tend to have tight or shortened hip flexors. So I'm going to go in today a little bit about what the hip flexor is and what we can do to make sure that it's staying loose. Unlike the hamstring though, I just want to kind of tell you guys, it's going to be very difficult for you to test to see if your hip flexors are tight. So in general, one way you're going to know if the hip flexor is an issue for you is if basically you get pain with prolonged sitting, or if going from sitting to standing bothers you, or if as you exercise at first you're getting some pain with movement and then it eases up. That's a sign that that hip flexor is staying restricted and could be contributing to your low back pain. The hip flexor is a very important muscle in stabilizing the low back because it actually attaches to the front of the spine. The hip flexor consists of a couple different muscles here, mostly the psoas and the iliacus. And these two muscles basically insert at the top of the front of the thigh called the femur. So this muscle is responsible for basically approximating the hip to the torso. When we're sitting all day long, this muscle stays shortened, and I brought my model spine here so that we can see. So this bone right here is called the pelvis, here's the low back, and down here is the femur. And so this hip flexor basically attaches from the front of the spine and the inside of the pelvis, and it forms almost like a triangle and goes to the hip here. So many times at the gym I see people going in these Roman chairs and doing leg lifts, and they're really not working on their abdomen too much. Really what they're focusing on is their hip flexor here. And what will happen is over time, as we're sitting, that muscle stays shortened and it's gonna pull our pelvis forward and extend our low back. And then what happens is as we go from a seated to a standing position, it hyperextends the back there and contributes to mechanical low back pain. If you're one that sits throughout the day 6 to 8 hours, there's no question that hip flexors are going to be involved in your low back pain. Also, I find this very prevalent in cyclists and people who bike for exercise, and also runners, because we have to engage those hip flexors to raise our legs to propel us forward. Also, kind of like what I alluded to before with people that are doing leg lifts, I see many people that are in the gym doing things like crunches, the leg lifts. Really, they're working their abdominal muscles and their core secondarily to their hip flexors. It's something I don't really advise. Now that we kind of have a little bit of an understanding of this hip flexor, how it might be contributing to our low back pain, what are a couple things we can do? One of the biggest things we must do is get up from the computer at least 30 to 45 minutes every hour. It only takes about a minute or two. Just very simply stand up, walk around, go get a glass of water, go to the bathroom, go talk to somebody, or just do like the Chinese fire drill around the car. Just walk around your desk for a minute, get those hips loosened up. Something else very easily we can do is while we're standing up is basically doing what I call a hip hinge or pendulum swing. Those of you that are into sports might be seeing baseball players do this before, where they're just standing up and they're swinging their legs back and forth. All right, as they're doing this, basically what they're doing is opening up that hip flexor there, getting blood flow going into that muscle. Really, really effective just to getting blood circulating when you're sitting all day. So we make sure that we get up every 30 to 45 minutes just for a minute or two, walk, do that pendulum swing, sit back down, get back to work. Something else we can do while we're sitting at the desk is actually something that I call a seated lunge. And what you can do is, I'm just gonna adjust this here a little bit. What we can do is while we're sitting, okay, put one buttocks on the edge of your chair so that all your weight is staying on the chair. Anybody can do this, whether you're out of shape, overweight, or if you're in good shape, you can do this. And then what you're gonna do is, the buttocks that's sitting on the chair is gonna stay in the front of your body, and then the other leg, you're gonna get as far back as you can, and you're gonna be on your tippy toes. And then what you do is while you're just holding that position, just contract your abdomen slightly and lean slightly forward on the chair. And that's gonna feel a good gentle pull throughout the front of the thigh there, and even sometimes up into the abdomen there, really gonna lengthen that hip flexor for you. And what you can do is you can do that, hold that for about 30 seconds to a minute, and then go to the other side, same thing, get that other leg back, all right? Contract the abdomen so that you're not extending the low back, and gently lean forward, hold that for about 30 seconds to a minute, hip flexor's loosened. Now you can get back to work, do the things that you need to do. Very, very simple. Something else I recommend everybody doing is when you get out of bed in the morning and when you get into bed in the morning is something that I call a lying hip flexor stretch. And so what you do is you lie on your back, all right, and you scoot to the edge of the bed. You're gonna keep one leg down where your toes are touching the floor and maybe even bringing it back slightly towards your buttocks. And then the opposite leg you can grab over or under your knee and pull up to your chest. While you're doing that, Contract your abdomen and flatten your low back into the bed, and you're gonna feel a nice gentle pull, letting gravity do the work, lengthening that hip flexor. If you're feeling discomfort with any of these movements or stretches, then there's no doubt that your hip flexors are compromised, and you might need to see a healthcare professional, somebody that's versed, like a chiropractor, working on these hip flexors to help loosen them up and basically get mobility going back in the lumbar spine and the pelvis. Try a couple of these things out. As always, if you're already having chronic low back pain, go get evaluated, see if the hip flexor is part of your problem. If you're feeling good overall, incorporate these couple of things, and this once again is going to help you prevent low back pain in the future. Hope you found this stuff valuable. If you liked it, please share. Make sure if you didn't see last week, check out my video on the hamstring. It goes hand in hand with the hip flexors. You do these two things, you're going to be setting yourself up for success in the future to make sure you prevent back pain. I'm Dr. Anthony Giacalone. Thank you for watching.